everyone. Hope you are doing very well today. Hope you're having a nice day. So, I'm Dr. Rabi Labaran Angambo, and I'm doing this follow up video from the last one I did on breast cancer, on the symptoms, on the risk factors, the modifiable risk factors, that is, the things that we can change that will reduce our risk of having a breast cancer, and also the screening modality, which I spoke of just one, that is the breast self examination. So, I had a lot of questions from people like, is that the only way to know if you could have a breast cancer? Are there other tests that you could do to know if you have a breast cancer? So this video is going to talk more about screening modalities, screening possibilities for breast cancer. So I'll start by explaining what a screening test is. A screening test is a test that is done way before you actually have physical symptoms of a disease. So if we say it's a screening test, it means you have no sign, you have no symptoms, you'll be fine. But it's screening because it is done before you actually start to have symptoms. So if you're already having symptoms of a disease, we can no longer call it screening, we'll now call it a diagnostic examination. So for the screening test that we have, I know in our context of Cameroon, it's a bit challenging because most of us might not have the finances to do the other screening test, but I would just like to give the guidelines for those of us that have the opportunity for us to be aware that this is what should be done, this is what could be done. So as I said before, one of the most easy, the cheapest and cost effective one way of screening is the breast self examination, which I explained how it can be done in the last video. So for the screening breast self examination, you do it by yourself, you do it at home, and that way you notice any changes that could occur in your breast, and then you go to the hospital for further screening or for further diagnosis to see whether what you found out could actually mean something or it could just be nothing. So after the breast self examination, now we have guidelines of what how women should screen for cancer all over the world. So it's the guideline says that at the age of women at the age of 40 years can do two types of tests to check for breast cancer. The first one is called a mammography, which is an x-ray of the breast. A typical x-ray, most of us know what an x-ray is. Like it is a filming of a part of your body. So a mammography is an x-ray of the breast. And so there's the mammography that can be done, and there's also what is known as an MRI, that's a magnetic resonance imaging, to check if there are cancerous cells in the breast. So if you want to screen for breast cancer, you need to go to your doctor, you go to the hospital. Now your practitioner, your doctor is going to decide which of these tests to do depending on your breast size and other factors. So it is advisable, the guideline is that at the age of 40, women do a mammography every 1 or 2 years till the age of 75. That is to say, if you're age 40, you should do a mammography every year or every 2 years until you're 75. And after 75, if the test has not picked up anything, you're probably not going to have a breast cancer. So now another thing of interest that most people want to know is, in our context in Cameroon, what are the places where can I go to get a mammography or an MRI? So I looked up some few hospitals. Of course, this list is not exhaustive, and if you have something, you can add on the comment section. So there are hospitals that could do mammography or MRI. One of those hospitals are l'Hôpital General in Douala. There is also the Oncology Center, also found in Douala. There's also the Bingo Baptist Hospital here in Douala. They do mammographies. If you want to do your screening, you could go there. There's also Padjo Puro, the Catholic hospital, which is found around Aquano here in Douala. I know there are places in Yaoundé, of course, like the Chantabia Foundation in Yaoundé. I'm sure there's Ashgoped in Yaoundé also. They can do screening tests for mammography. So basically, it's important to do your screening because screening can save a lot of lives of women. Early screening, early diagnosis the prognosis, that's the probability of being completely treated, is better off when you're diagnosed before you start to have symptoms. So it is important for us to screen for breast cancer to decrease the death rate that we have. Thank you very much for watching. Thank you for listening. You can put your comments in the comment section. You can like. If you have a question, you can ask. If you know somewhere that they do mammography or MRI, which I've not mentioned in this video, in other places, of course, please drop it in the comment section. It can be of help to somebody. Okay, thank you very much for watching. Thank you for all the feedback. Thank you for everything. And of course, if you have a question, you can leave it in the comment section. If you have something else you want us to talk about, you can of course drop it in the comment section. Have a nice day.